self-care for hiatal hernia and how to deal with that yourself. Some things that you can do to be helpful. So what a hiatal hernia is, you have your diaphragm right here. And then your esophagus comes down and it has to go through a hole. So that hole in Latin is called a hiatus. So that hole in the diaphragm is where your esophagus comes through and your stomach sits right below the esophagus. So this muscle, this diaphragm is a muscle, and then that concentration of that ring of muscle around that hole is called a sphincter. And that sphincter is supposed to be tight so it keeps your stomach down. So we call that a valve, but it's really a sphincter that's holding the stomach down. And that sphincter can get irritated from different things that you eat. Anxiety can irritate it. A blow in the belly can irritate it. The way you lie down can irritate it. And that sphincter can loosen up, and then the stomach can go up into that hiatus, into that hole, and now that can tighten down, and you can get a bubble in your stomach above that hiatus, above that hole, above that sphincter in the diaphragm. And then that can cause a lot of problems. The same nerves that innervate that sphincter innervate your heart, and you could get what's called a pseudocoronary from a hiatal hernia, because you could get the exact same symptoms of a heart attack. People have gone into the ER thinking that they're having a heart attack, and it's actually a hiatal hernia issue. So to deal with a hiatal hernia surgically, then they'll go in and pull that down and make some stitches to make that sphincter smaller. That's only in very, very rare conditions that anything like that's going to need to be done. Most hiatal hernias, probably 99% of them, are what are called functional hiatal hernias, meaning it's not going to stay up there all the time. If a person has cancer or something like that in that area, that's where it becomes more of a clinical hiatal hernia, where you have to do something with a surgical intervention. But for a functional hiatal hernia, you want to pull the stomach down physically, and this can take time. That muscle can take time to heal and calm down. People tend to be prone to these. They have a weakness of that sphincter just because of irritation to their gut that's causing this to happen constantly. I tend to have, especially when I was younger, I was really prone to these. It was really a problem. Lately, it's not so much of a problem for me. But one of the issues with this can also be that one of the causes can be actually a lack of. So what do you need to digest food in your stomach is hydrochloric acid. So that's what breaks down carbohydrates in your stomach so it can go into your small intestine. When you lack hydrochloric acid for multiple functional reasons, look at our gut check video, we talk a little bit about that. Can be a bacterial infection, a H. pylori in your stomach. It can be, eating a bunch of junk food, so your stomach cells aren't making enough hydrochloric acid, so you're not breaking down that food. Then you could get a lot of gas formation in there, that your carbohydrates are fermenting in your stomach, and then that can cause this bubble to come up, and that can be the cause of the hiatal hernia. So cleaning up a person's diet, starting to take a digestive enzyme with HCl with your meals only can be the solution for that. That's what fixed mine. And then you'll get that proper digestion. You won't get that stomach pushing up that way. But from a physical standpoint, if you have the symptoms of heartburn, if you have the symptoms of acid reflux, if you have the symptoms of stomach pain, what you want to do is tug down on the stomach. Now, from an anatomical position, you have your rib cage here, and then you have your sternum, and at the end of your sternum you have this little teeny bone called your xiphoid process that sticks down. You do not want to push on your xiphoid process. That will be painful, that could be dangerous. So you want to feel where your ribs come together, where the bottom of your sternum is, and where that little teeny finger-like bone that sticks down just like this, called your xiphoid process, is, and go below the xiphoid process. So you got to get practice into feeling this. And then you're going to go below this. So this is the way I teach doctors to do it. So once you're below the xiphoid process, your force has to be in this direction. So you're kind of grabbing the stomach. So think of the stomach sitting there, and you're going in there and grabbing the stomach, and you're pulling the stomach down like that. So if you can envision pulling the stomach down and then you're pulling it down from the diaphragm like this, that's what will help you. So you go below the xiphoid process and then you're tugging the stomach down. Now obviously it's harder to do this on yourself. How are you going to do this on yourself? Well, you can lay down on your back and do that same thing like that and just try to pull down on your stomach. You have to relax the stomach muscles in order to do this. So if you're going to reflexively tighten up like this, then that's not going to help. So try to relax and pull your stomach down like this. Try to relax and pull your stomach down. You're pulling down in a direction of about 45 degrees in this way. The other thing that you have to be aware of that can be cause of this is excessive constipation. So getting your gut moving, taking some gut healing supplements, some products that will help your gut move and get peristalsis going here, that will be helpful too. The other thing that could cause problems with this is anxiety. So anxiety itself can cause that sphincter to loosen up and cause the stomach to go up. So deal with anxiety issues as well. The other way that you can deal with this is, I'll show you on myself. So I work on this. So when I have stomach issues like this and hiatal hernia issues, I'll do it standing up tends to work better for me. So I come in off my xiphoid process and I'll just tug down like this. And I'll try to stand up straight while holding my hands there. So it's just tugging down and then just pulling myself back while trying to hold my hands steady. It's not a perfect procedure. It's difficult to do yourself, but that could give you a lot of relief doing that. Also, if you go to a doctor that does physical medicine, you might want to have them look for adhesions that can build up along your diaphragm attachment to your rib cage, and that is where they're going to go in there and work on adhesions. You can do this yourself or have your massage therapist or physical therapist do this as well. So some physical medicine doctor will help with that as well, because that could be an issue. Post-surgical adhesions could cause hiatal hernia issues. Digestive issues, lack of HCl in your stomach, lack of digestive enzymes, constipation issues, and anxiety. All those, add those all together, it's really easy to get functional hiatal hernia symptoms. So this is one way that you can work on this. You can't overdo pushing on this, you can't overdo pulling on this, but you can make yourself sore. You could even make yourself black and blue if you really pushed on it hard. Don't do that, but just constantly tug down that can help a lot with your symptoms.
If you're looking for a way to relax your diaphragm or your abdominal muscles when you are pushing on that hiatal hernia, is to focus on your breathing. When you breathe in, you tense up and you add air into your diaphragm, and that will tighten that area up. But if you focus on maybe inhaling beforehand and exhaling as you push, you tend to relax your stomach muscles and empty out your diaphragm of air, and that might help you in the process. So instead of focusing on just the pushing and tightening up to push, focus on the breathing. In before you push, exhale as you push.
There's one other thing that is a major cause of hiatal hernia issues that we should address too, and that is people that have had neck injuries. So if you had a whiplash injury, or even if you slept wrong and you have a lot of adhesions and inflammation in your neck, remember, every time you take a breath, what a breath is your diaphragm contracting. What a diaphragm contraction is this. So your diaphragm contracts like this, and by doing that, it sucks, it draws air into your lungs. That's what a breath is. So a breath is your diaphragm pulling down, drawing air into your lungs. So every time that happens, think of your stomach sitting right below your diaphragm like this. Your stomach has to drop down a little bit every time you breathe. It's going like this. Breath in, breath out, breath in, breath out. That means your esophagus is moving. Your esophagus is moving in your chest. If you get adhesions up here on your esophagus, adhesions from your clavicle, these muscles right here go up to your neck in kind of a triangle form here. They attach to your neck there. You can get adhesions in there from inflammation in your neck from whatever reason, and then that attaches to your esophagus and doesn't allow that esophagus to slide nicely. So working on having maybe a massage therapist, your chiropractor, or physical therapist, work on some adhesions in here. You could do that a little bit yourself, and you'll find that they really can be tight and sore. Be careful of your carotid artery, obviously. Be careful you don't dig in there with fingernails and hurt yourself. But working on your neck or going to somebody who can work on your neck or massage this whole area can be extremely helpful with this too. All right, there's your tutorial. Thanks.